Let's begin by exploring the cranial meninges, the brain's primary line of defense. The meninges are three protective layers that encase both the brain and spinal cord, forming a crucial barrier for the central nervous system. These membranes serve multiple purposes. They shield delicate neural tissue from injury, provide structural support for blood vessels, and facilitate the circulation of cerebrospinal fluid, or CSF. Imagine them as a multi-layered shield, each with unique properties and roles. Understanding these layers is essential not only for anatomy but also for clinical practice, as many neurological conditions are linked to meningeal pathology. As we move forward, we'll break down each layer and highlight their structural and functional significance, setting the stage for deeper clinical insights. Now let's dive into the three distinct layers of the meninges: duramater, arachnoid mater, and pyomater. The duramater is the tough, double-layered outer membrane, closely attached to the skull and providing robust protection. Its folds, such as the falx cerebri and tentorium cerebelli, help compartmentalize the brain. The arachnoid mater, named for its web-like appearance, bridges over the brain's grooves and is key in returning CSF to the bloodstream via arachnoid granulation. Innermost pyomater is highly vascular, adhering tightly to the brain's surface and supporting blood vessels. Between these layers are spaces, epidural, subdural, and subarachnoid, that play a critical role in pathology. The subarachnoid space filled with CSF cushions the brain and is central to fluid dynamics. Understanding these layers and spaces is vital for recognizing clinical conditions like hematomas and meningitis. Let's focus on cerebrospinal fluid, CSF, and its clinical relevance. CSF is produced in the choroid plexus, circulates through the subarachnoid space, and is absorbed by arachnoid villi into dural venous sinuses. This fluid acts as a cushion, protecting the brain from trauma and maintaining homeostasis. Disruption in CSF flow or meningeal integrity can lead to serious conditions. For example, an epidural hematoma often results from arterial injury, presenting as a lens-shaped bleed on imaging. Subdural hematomas are usually venous, slower in onset, and crescent-shaped. Subarachnoid hemorrhage, often due to aneurysm rupture, fills the CSF space and presents dramatically. Meningitis, the inflammation of the meninges, can be viral, bacterial, or fungal, each with distinct clinical signs like stiff neck, fever, and photophobia. Diagnostic procedures such as lumbar puncture target the subarachnoid space to analyze CSF for infection. Recognizing these pathologies is crucial for timely intervention. Clinical signs of meningeal pathology are vital for diagnosis. Symptoms like nuchal rigidity, high fever, and photophobia often point to meningitis, which can be viral, bacterial, or fungal. Lumbar puncture is a key diagnostic procedure, targeting the subarachnoid space to sample CSF and test for glucose, protein, and bacteria. Imaging anatomy, including basal cisterns, ventricle sizes, and midline shifts, helps clinicians identify hemorrhages and other abnormalities. Recognizing these signs and using appropriate diagnostic tools ensures timely and effective treatment. In summary, the meninges are not just anatomical structures, they are the brain shield, dictating clinical outcomes in trauma, infection, and vascular events. Understanding their layers, spaces, and associated pathologies is essential for anyone studying neuroanatomy or practicing medicine.